We are with Dr. Eddie Fernandez, and we are at the Center for Vein Restoration. And today we're talking about what causes varicose veins.
Thank you so much for having me. Varicose veins are a result of a faulty valve within the venous system. So veins return blood back up to the heart from the legs and all extremities through the use of these simple valves. They open, they close, and they allow the blood to flow up, but prevented gravity that we're always fighting to bring it back down. And when those valves fail, then the blood can pool, and that pooling creates pressure, which is what leads then to the formation of these engorged veins. And later on, as the disease progresses, swelling and skin manifestations such as hyperpigmentation and ulceration.
How can pregnancy and lifestyle affect varicose veins?
So these are huge risk factors. So obviously we have the genetic and age. But in the case of lifestyle, patients who are in occupations of prolonged standing or prolonged sitting, in which they are not using the muscle of the legs as frequently, that leads to more pooling of the blood. And more pooling equals more pressure, more disease. And those valves get further and further damaged. Pregnancy goes in a slightly different route. So first you have the fetus growing, and as the fetus grows in the uterus, it puts pressure into the pelvic vasculature. That pelvic vasculature obviously limits upflow of blood from the lower extremity. So it's putting pressure in that vasculature, which can then distend and injure the vessels. Also, the hormones of pregnancy can cause further dilatation of those vessels, causing further injury.
Let's talk about some of the treatment options at the Center for Vein Restoration.
Yes, so we have the full array of venous treatments. We provide all options, including laser, sclerotherapy, radiofrequency, as well as a venous seal, which is a form of glue, and also MOCA, which is a mechanical occlusive ablation. So we have the greatest array of options for treating, and my passion for that is that we can fit the treatment to the patient's need rather than fitting the patient to the treatment.
And speaking of treatments, are these covered by insurance?
Absolutely, and the reason they are covered for insurance, as I tell my patients, is because letting these go untreated will lead to chronic problems such as swelling, fleval lymphedema, hyperpigmentation, and even ulceration of the lower extremities.
All of your clinics across the DMV are safe to visit during COVID-19.
100%. We've been open since a lockdown started March 16th. We've done it safely for our patients and for our staff, and we're proud of that.
You guys are the experts across the nation when it comes to vein restoration.
We are the largest provider of vein vascular care nationwide, which we've done it through great care.
And people can get more information by calling the number on the bottom of their screen. Dr. Eddie Fernandez, thank you so much for your time.
Thank you so much for having me.